We would start off with the physical examination of the individual in detail over here. Now, fever is going to be very suggestive for these patients because that is going to give you clues towards the infectious states that are prevailing in the individual. Systemic infections can be one of the causes of the fever. Then we can have bacterial meningitis as one of the causative factors. Encephalitis is one of the leading cause. We can have heat stroke down the list. Neuroleptic malignant syndrome, which is related to the drug use. Malignant hypothermia due to the aesthetic conditions or due to the aesthetic procedures that you usually performed for the individuals. And then we have the anticholinergic drug intoxication syndromes. Central fever is basically PUO, that is basically the pyrexia of unknown origin that usually prevails in the individual. Now, fundoscopic examination is very critical over here, and that is going to reveal a lot of factors, as well as skin is going to be observed in detail, and that is the very important, crucial part for the physical examination. Now, the fundoscopic examination reveals subarachnoid hemorrhages, hypertensive encephalopathies, increased intracranial pressures in the individual. That is again going to subdue a lot of pressure on the cortical regions. Papilledema is one of the features that would be revealed on fundoscopy. When you look for the features on the cutaneous side, the cutaneous petechiae are responsibly present, and they're usually the result of the TTP, that is the thrombotic thrombocytopenic purpura that is prevailing in the individual. Patients with meningococcemia, bleeding diathesis associated with an increased intracerebral hemorrhage phenomena. Then bluish discoloration, which is known as a cyanotic condition, reddish or anemic skin colorations in the individual are noted for, and they're indicative of the carbon monoxide poisoning. Cherry red discoloration of the skin is indicative of carbon monoxide poisoning. Other findings would include the findings for hypothermia, usually associated with the use of alcohol, misuse of alcohol and sedatives. Phenothiazines intoxication is one of the causative factors resulting in the hypothermia. Hypoglycemia, peripheral circulatory failure, extreme hypothyroidism. So you check for these hormonal levels as well. You would check for the thyroid levels in the blood, and any levels indicating hypothyroidism would be critical. Then we have tachypnea, a term that is describing a decrease in the respiratory rate associated with systemic acidosis or pneumonia, rarely infiltration of the brain with lymphomas. Conditions such as marked hypertension. So you'd even ask the patient if he's a known hypertensive or not, if he's taking some kind of medications for the hypertension or not. Hypertensive encephalopathy usually prevails in these individuals. Cerebral hemorrhage is indicative, and then we have head injury, which is associated with hypertension. Hypotension, a decrease in the blood pressure, is again one of the causative factor, one of the underlying etiological or pathological features. Coma from alcohol or barbiturate intoxication, internal hemorrhages, and myocardial infarction are some of the conditions or some of the states that can result in hypertension. Again, hypertension is basically linked with a decreased blood flow towards the brain, and maintaining a normal blood flow for the passage of nutrients, for the passage of energy supply towards the brain tissue is very critical for the maintenance of the conscious levels in the individuals. Then we have sepsis, which is again resulting in the hypotension. We have profound hypothyroidism, resulting again in a condition of hypotension. And finally, we have the Addisonian crisis, a lack of the parathyroid hormones, again going to result in the final condition of the hypotension in the individual.